So your blood pressure was 140/90, which is considered hypertension. I can see your doctor prescribed you Captopril, which is an ACE inhibitor.
Captopril is used for hypertension, which reduces the risk of cardiovascular mortality. It is also used for heart failure by causing venous dilation. Captopril is also used for left ventricle dysfunction after MI and also with diabetic neuropathy.
How should I take this medication?
So Captopril is usually administered orally. It is available in single drug formulations and fixed dose combinations with hydrochlorothiazide, and it should be administered 1 hour before meals.
Interesting. So is there any other consideration I should consider about?
Yes, that's a good question. We do advise you to check your BP regularly and keep a journal of all your blood pressure recordings. While on this drug, you should also minimize your use of NSAIDs. If you have any early signs of infection, such as a fever, sore throat, or mouth sores, please notify your prescriber immediately. You could also develop a persistent, dry, irritating, non-productive cough, which should also be notified by the provider. And while recording any of your blood pressure readings, if you do see that you have hypertension developing, you may feel dizzy, and we do ask you to lie down immediately.
Okay.
Captopril should also be determined by taking the patient's blood pressure, obtaining their white blood cell count and differential. Use caution in patients with salt or volume depletion, renal impairment, or collagen vascular disease. You should also use caution in Captopril with patients who are taking potassium supplements, salt substitutes, potassium-sparing diuretics, ARBs, aliskiren, or lithium. Women who are of childbearing that are taking ACE inhibitors during their second and third trimester can also cause major fetal injury, and taking drugs may pose risk as well.
Common side effects of Captopril are first dose hypotension, cough, hyperkalemia, fetal injury, renal failure, and neutropenia. One rare and potentially fatal effect is angioedema, which is characterized by giant wheals and edema of the tongue, glottis, and pharynx. Diuretics should be avoided because they can intensify the effect of the first dose hypotension. It should be withdrawn 2 to 3 days before an ACE inhibitor drug is started. Antihypertensive drugs should be avoided because when combined with ACE inhibitors, their effects are addictive. Drugs that elevate potassium levels should also be avoided because ACE inhibitors have potential to cause hyperkalemia itself. Lithium should be avoided because when combined with ACE inhibitors, it can intensify the effects of lithium, leading to toxicity. Non-steroidal anti-inflammatory effects like NSAIDs, example of this is the over-the-counter aspirin, should be avoided because they can affect hypertensive effects of ACE inhibitors. So when to call the provider? Contact the physician about signs and symptoms of infection, such as sore throat or fever. If chest pain, SOB, or nausea occurs, it could be by hyperkalemia. Symptoms of vomiting, diarrhea, or excessive sweating can cause severe hypotension and should be notified. Report signs of edema of the tongue, lips, or eyes and seek emergency care because this could be life-threatening and fatal.